I'm Dr. Tom Cheatham, a family physician who spent 3 decades providing primary care to people with intellectual and developmental disabilities, predominantly adults. Today, I want to present another in the Clinical Pearl series, and I want to take you through an important tool that will help caregivers prepare information for a PCP visit. We've talked about the fact that it's overwhelming as a primary care provider sometimes, and where do I even start to address someone with a behavioral challenge? And this is the first of a series of 2 presentations which will help answer that question. The first section includes what type of disability does the person have, the etiology. That can be important in setting the stage for a differential diagnosis. And it's also part of that first section in terms of level of functioning. A person who has a mild level of intellectual disability has different challenges from somebody who may have a severe or profound level. The next section talks about the behavioral problem in as much detail as the caregiver can provide. When did it start? When was the person last at their best without the behavioral issues? A description of that. Are there triggers that the caregivers sorted out? Are there timing issues? Do we know when it occurs? What things have been tried? And is there significant past history about the behavior? The last section on the first page of this tool talks about risk. It's important to consider risk to the person, to other people, or to the person's environment. And then if there are significant risks, what's the level of damage and how often does that challenging behavior occur? Next is a sort of checklist of changes or deterioration, things like mood, bowels or bladder, appetite, sleeping, some of the physical health changes that we might see associated with challenging behavior, changes in communication, interest in activity, something that the person preferred to do in the past now seems to hold little interest. What about seizures? What about their self-care? And again, all of these things are assessed against the person's previous level of functioning. The next section talks about possible physical health problems or pain, and other presentations in this series talk about pain and physical health issues in a little more detail, but it's inquiring of the caregiver if either health issues or pain could be a factor in the behavior. An important part of that is how would we know? Well, would we know? But then how would we know the person is having pain? That's a critical issue because sometimes people with intellectual and developmental disabilities may not show the same pain behavior that other people would, and that is so easily misinterpreted as, oh, the person doesn't feel pain, when in fact that's not correct. So pain is easy to miss. And I ask you to just think for a moment if you had something that was causing you pain and you had no way to communicate to someone else. And then another important piece of that around health problems are medications. Could it be related to a medication side effect? Moving on, we look at environmental changes. Are there any recent circumstances such as a change in caregivers or the living environment or the person's day activities, be it work or school, depending upon age, other people in the environment, if the person lives with other people, has there been a change there? Those sorts of things. Next, we look at supports, and part of supports is vision and hearing because those can be insidious in their onset, and it may be that the person is exhibiting behavior because they cannot see what is being required of them, or they can't hear what you're asking them to do. What about sensory triggers, especially people on the autism spectrum who may respond in quite different ways to light or noise, may have extremely acute hearing, or be sensitive to certain textures. You know, sometimes we'll react to a label that irritates our skin. Imagine that magnified many times in terms of the possible effect on someone. What about energy and physical activities? Are there mobility problems? Are things too demanding? Those sorts of things. Because all of those require additional supports and being able to define what those supports should be. Next, we look at emotional issues. Here again, we're looking for changes in relationships, family, friends, someone with whom there's a close relationship. And that might be an addition, a loss, some sort of separation. A friend from the community just doesn't visit the way they used to, or the death of someone close to them. Also in this section, it highlights possible abuse or assault. We know adults with intellectual and developmental disabilities have a very, very high prevalence of abuse and neglect, and that can be physical, sexual, emotional, or the person may have been exploited. So those are important elements to be aware of. And then things that other people would also be susceptible to: teasing or bullying, being left out of activities, being stressed, again, with activities that the person's not able to do. So a detailed list there of those elements. And then lastly in this section is there a diagnosed psychiatric condition in terms of past history? Now beware that, because it's very hard to make psychiatric diagnoses with confidence. The more a person is towards the end of the continuum at severe or profound level of intellectual disability, the harder it is to make those diagnoses, because those require self-report of internal feeling states and so on. So beware of past psychiatric diagnoses. They may or may not be accurate. And then the last part of this tool gives the caregiver a chance to outline things that no form can possibly encompass, so they can include this. And then a big part of it too, given the turnover of caregivers, paid caregivers, is education needs. Are there supports for the caregiver that would be important, that could help address some of the challenges they face in supporting that person? Are there educational activities or information that might be able to help? All of that information is completed by the caregiver in conjunction with the person before visiting the primary care provider. And in the other part of this two-part series, we'll look at a very similar tool that's designed to help the primary care practitioner summarize that information and take it further. Thank you very much.